something that's often overlooked for weight gain and exhaustion, your thyroid. Here to tell us more about this is Dr. Nathan Vitaro and RN Sue Carroll from LifeGuard Clinic. Good morning to both of you. Thanks for joining us. This is a good topic. I think a lot of people have this issue. First, tell us, what is LifeGuard, Sue?
LifeGuard is a wellness clinic, and essentially what we like to do is find out what your problems are and what the cause of those problems are, as opposed to just treating symptoms. Okay. So we'll find out the cause and then treat the cause.
Gotcha. So we're talking about thyroid disorders, right? What are some thyroid disorders?
Right. So for people that don't know, the thyroid itself is a small butterfly-shaped gland that sits at the base of the neck. And what I tell all my patients is that the thyroid is really like the mother of all your hormones. Oh. So if your mother's not happy, nobody else is, right?
Sure.
So you really have to pay attention to the thyroid. And your thyroid can either be overactive, where it produces too much thyroid, or it can be underactive. And these are some of the disorders. There's also an autoimmune component. And I don't know if you're familiar with that word or not, but basically autoimmune thyroid means that your body's immune system is a little bit misdirected, and so it sets up a little attack on the thyroid.
Oh, okay.
And it can cause a lot of problems that way.
Well, what are some of the things that the thyroid does?
Well, it controls your metabolic rate, it controls energy level, it controls your ability to lose weight.
I see. And what are some of the most common symptoms that people have, disorders or so forth?
Yeah, so it really depends on what the level of dysfunction is.
Okay.
If a person has overactive thyroid, for example, they might be producing too much thyroid hormone. And so that creates unwanted weight loss, which, you know, sounds like everybody would want, but it can get to be a dangerous kind of symptom. It can cause heart palpitations, anxiety, and so forth. But more commonly is hypothyroidism.
Hypo.
Right, correct, where there's a lack of thyroid function or a lack of thyroid output. And this disorder is much more common in women than it is men, although some men do have it. But nonetheless, this hypoactive thyroidism leads to pretty much immense fatigue, weight gain, hair thinning, and sometimes even an irregular menstrual cycle as well.
Well, I was wondering, when it comes to thyroid testing, is it an easy thing to find and say, oh yeah, you have hypothyroidism, or does it take more involvement with testing for it?
Testing for thyroid, what we look at is we have a blood draw, and then there should be a picture up that people can look at, and there's several different parameters that we like to look at in LifeGuard. I showed this visual because there's one thing that you can look at, which is a TSH. That's the common test that people have when they go to their doctor.
The regular doctor.
The regular doctor.
Okay.
If they only look at the TSH, it may not show that they have a problem. In other words, that result may come out normal, but the other parameters may be grossly abnormal. And so we like to look at more things so we can determine if you really have a problem, and then we can figure out how to treat you best.
That's a really good point, because I think a lot of people probably went to their general practitioner and they, oh, well, my thyroid's fine, and they forget about it and they never even bother to have it checked again, thinking, well, it was fine. Can it change as you grow older?
It can, and what I find a lot of times too is that if a TSH is run and not the whole picture is looked at, you miss a wide portion of what's actually going on. And for a lot of our patients, they'll come in with a normal thyroid panel, and it's not until we check for antibodies, which does not get tested a lot.
Yes.
It's not until antibodies are tested that you pick up on that autoimmune component.
That's a good point. Now, you've got a lot of different things that people can take, and you also have a special offer. So if you're watching right now and maybe you thought, you know what, that might be what's been bugging me, or that might be what is my problem, you have a special offer so people can get checked.
So first of all, there's a little test on our website which people can take to help them determine if maybe they do have a thyroid problem. So it's a little questionnaire. And we are offering a free 30-minute consult and also a wellness assessment for the first 25 callers, and also $25 off your next visit.
Very nice. That's something definitely worth to get checked out, especially if you're tired and you're overweight, and so many people feel that way, and they've tried everything, this might be the problem. Thank you so much again for joining us. Very
Thanks for
good
having us.
information.
Yeah.
So if you would like more about LifeGuard Clinic, you can visit them online at lifeguardclinic.com, or you can call the number you see right there on your screen.